Hi, my name is Ryan Becker, and I am a music therapy student at Utah State University. And I have decided to share some information with you about music therapy and how it compares to music education, especially in regards to working with adolescent populations. So, let's see. There we go. A little bit about me first before I dive too far into it. So, I am, like I said, I'm a student at Utah State University studying music therapy. I am not originally from Utah. I'm actually from Milwaukee, Wisconsin, but I came out to uh, here for school, and I'm really into academics and research and everything in that regard. I love learning. I actually have had a few really cool experiences in the last couple of years of my program here to work with my music therapy, or not my music therapy, my music theory professor, Dr. Timothy Shinnett, to present some research. So just last fall, in the fall of 2022, Timothy Shinnett, myself, and one of my peers presented a research poster at the Joint Society for Music Theory, the Society for Ethnomusicology, and the American Musicological Society. That joint conference, we presented our research, and it was really cool. It just reinforced my love for research, my love for learning, my love for academia, and it's only reinforced my want to become a professor someday. I want to teach and be the next music therapy professor, just like the ones that I have here. That's my goal. So it's actually kind of ironic that I'm giving this presentation to compare music education and music therapy, but I hope that I can share a little more about it with you so that it's clear for you. So first about music therapy in general. There's a couple of professional organizations. The first one, the most famous, especially in the United States, is the American Music Therapy Association, or the AMTA. And just as a disclaimer, I don't own these images. They come from the organizations themselves. Um, but this organization, the AMTA, is the one that it sets the standards for music therapy, the code of ethics. It releases information about changes in music therapy practice in the country and all those good things. The CBMT is works in association with AMTA. It's the Certification Board for Music Therapists. So they are the organization that collects all the information from various music therapists, sends out surveys, and determines what the most important competencies there are for music therapists to know. And they create an exam that all music therapy students have to take in order to become certified to practice in the country. Um, and in addition to these organizations, there's also journals that are released by them that discuss specifics and the latest research having to do with music therapy, one of which is the Journal of Music Therapy. Then there's also Music Therapy Perspectives, and there's also music therapy journals in other places of the world, such as the Nordic Journal of Music Therapy. But that's just a couple, just to name a few. There's several more. So what does it take to become a music therapist? Well, there are a couple different ways, but the most common way is to complete an undergraduate program, um, and then take the board certification exam so that you can get the MT-BC, Music Therapist Board Certified, after your name. So the AMTA has set standards that every undergraduate program has to meet in order to fit the requirements for a student to be able to take the certification exam. And those three areas that are targeted for every undergraduate program are musical skills, clinical skills, and treatment skills. So, first of all, musical skills, every undergraduate program is going to have expectations involved with learning to have better vocal techniques, learning to play guitar, learning to play piano, learning percussion techniques, in addition to music theory, aural skills training, music history, and several other music oriented classes, in addition to the general education courses that are required for your institution. And then, second, there are the clinical skills. So, this is about learning to have a therapeutic presence. This is about learning about the different scopes of music therapy, such as dialectical behavior therapy with a music therapy emphasis. That's NMT, which stands for neurological music therapy. And this is also talking about the different psychological scopes of practice, such as cognitive behavioral therapy and psychodynamic or psychoanalytic behavior or therapy. So there's all these different theoretical parts of music therapy that uh, get applied in the clinical aspect of music therapy. And then third, there's treatment. And this is most commonly referred to as RATIDET or RATIDET, which stands for referral, assessment, treatment plan, implementation of the treatment plan, data collection, uh, evaluation. Sorry, I forgot which letter was next. And then the termination process. So music therapy students are required to learn that process, learn what each step in the process entails, learning how to collect data, learning how to assess, all of those great things in order to be competent enough to practice in the field. So now we get back to our original question. What does music therapy with adolescents look like, and how is it different from music education? So, in order to talk about this, I thought we should bring up the 6 elements of music therapy because then we can compare how these elements are different than the elements you might see in an educational format. So, first of all, music therapists work toward non-musical goals with their clients. And that means that we're not trying to teach our client how to play guitar, though that may be part of the treatment. That's not our main goal. We're not trying to teach them how to sing better or how to do a trill on the piano. That's not our goal. Our goal is whatever is needed in the situation, which the most common goals with this population are teaching coping skills, increasing communication, stuff like that, things that aren't specifically music related. The second element of music therapy is that it's research based. So everything that we do in music therapy is data driven. It is with the newest research that has been released by the journals of music therapy that we discussed earlier to inform our practice for the better. And though music education is also based on research with pedagogy and whatnot, this research is specific to music therapy. So the third element of music therapy is that there is a board certified therapist. Like we mentioned earlier, the CBMT is in charge of giving the exam that music therapy students take in order to become certified. And this means that you can't have someone come to an assisted living center just to play piano as music entertainment. That's very, very different. Music therapy has the board certified therapist as approved by the AMTA. Then music therapy is part of the medical field, which is very different from music education. Music therapists often work in hospitals or assisted living centers alongside doctors and nurses as part of the treatment team. And that's very, very different from music education, as you may know. Fifth is the therapeutic relationship. So just like traditional verbal therapy, music therapy, the music therapist has a safe and trusting and confidential relationship with their client that's agreed upon and established so that growth can happen and that a client can work towards their goals in a safe environment. And then finally, music therapy has a treatment plan. Like I was talking about with the board certified therapist portion of this slide, this is not just going to involve a music entertainer coming in to play music for an individual. Music therapist, once they take a client, creates a treatment plan and they think about what are the goals that this client's going to be working towards. How can I implement interventions that will work towards these goals? And what will my data collection look like? Data collection is huge, a huge differentiator between music therapy and music education, because though music education it tracks your progress with grades and whatnot, that's very different than collecting data towards music therapy goals. So treatment goals. I want to get more into this. And the best way that I can get into this is to share with you my personal story of when I worked with a group of adolescent girls with learning disabilities and cognitive disabilities in my second practicum experience. So the 3 goals that we labeled and that we were working towards in our treatment were first, to increase social skills, second, to increase communication, and third, to decrease maladaptive behaviors by means of teaching coping skills. So the first one, what that might look like in a session is um, one way that we implemented this is by using improv. So my partner and I would facilitate a group improvisatory experience where all of the girls would sit in a circle together playing either drums or small percussive instruments, auxiliary instruments like cabasas or egg shakers. And then one of the clients, one of the girls would be asked to come up to the piano with the music therapy students and improv on the piano with the student, with the music therapy student, myself or my partner. And all of the other girls would support with their percussive instruments. And this pushed the soloist outside of their comfort zone, and it allowed a space for the other clients to support the soloist and for the soloist to reciprocate that by supporting the next soloist. So that really built rapport between the clients, or built stronger relationships between them, so that they could become closer and have maybe more meaningful relationships outside of music therapy, the music therapy session. So the second goal, increasing communication in order to empower the group members. So oftentimes we would do this by having a musical intervention that involved call and response or some type of musical dialogue with turn taking, because this required the clients to understand, when is it my turn, when is it my peer's turn, and oftentimes would I have to reflect what the other peer just did, or am I going to create my own musical message to send to them? We did these types of interventions a lot, of musical message sending, and we would ask them to accept the response or accept the message and then send their own. And this would help build communication skills and learning how to interact in a typical verbal conversation outside of a music therapy setting. And then the third treatment goal that we targeted, decreasing maladaptive behaviors in order to improve the quality of life, coping skills. So we often did this by doing some type of songwriting experience, or the most common of which would be fill in the blank songwriting. So in fill in the blank songwriting, we would, like, here's an example. We use the song Firework by Katy Perry. And in this situation, we would have them fill in the verses with things that really like frustrated them or made them uncomfortable or made them sad. And then during the chorus, Baby, You're a Firework, that's when they had an empowering experience. And we also talked about breathing. We talked about progressive muscle relaxation, other coping mechanisms that these girls can use, and we implemented them into the songwriting process so that they can remember when they think of that song, oh, these are all my coping skills that I know. This is how I can calm down in a time of stress or frustration, or fill in the blank here. Um, and I we saw a lot of growth and participation in our clients when we did songwriting experiences, because they really took it to heart. And I know that songwriting is something that is very important to adolescent populations, and it's a means of self-expression. And so I think we saw that it was very effective with the clients that we worked with. So I know I shared so much information with you, and this is just the tip of the iceberg, especially when it comes to this particular population. But if you have more questions, you can always reach out to the AMTA website, which is at www.musictherapy.org. And you can also reach out to the journals that I described earlier, with the Journal of Music Therapy Perspectives, the Nordic Journal of Music Therapy, and many others. And there's so many great resources, research papers, everything out there that you can reach out to. And if that doesn't answer your questions, there's also, I've put here my email and my phone number. If you need to call me, I can try and answer whatever questions you may have. But thank you for listening to my presentation. I hope that this was helpful for you, and I hope that you do reach out with questions, because I'd love to help out in any way that I can. Thank you.